Hello guys, welcome once again to my channel. This is Evangel, your girl, sister, your friend. Please, if you have not subscribed, please subscribe to my channel. If you have not hit the bell sign or the bell icon, please hit the bell icon so that anytime I upload any video, you will get it. Remember what this channel stands for. We talk about business here, we talk about health here, and we talk about lifestyle generally. Like I said at the beginning of my video, I don't know if I said it or not, I am a doctor by profession and I am an entrepreneur by passion. And the two things that I'm passionate about. So when you come to my channel, you hear about health information, take it. And you come the next time you hear about how to succeed in your business, take it. Because this woman here, I have been through a lot when it comes to business. I have actually had so many businesses that I opened in the past, that I engaged in the past, and they failed. Yes, you heard me right. They failed. But I didn't fail. The businesses failed. Remember what I said? The businesses failed. I didn't fail. I only learned how to do business the proper way. So make sure you hit the like button, make sure you hit the subscribe button, and I will be coming your way more regularly because for some time now I have not been uploading videos. For now, I'll be doing more of videos, I'll be uploading more of videos, and we can chat in the comment section. Whatever you feel about this, if you love my hair, this makeup, I'm just looking at the screen instead of looking at the camera, but then this makeup took me about 10 minutes. I think it's one of the longest I've had, and the reason it took me about 10 minutes was because I tried to put eyelashes, but believe me guys, it didn't work. It didn't work. I removed it. I removed the lashes because I was tearing, my eyes were red, I couldn't open my eyes, so I literally removed the lashes. Who did this to me? Must you wear false lashes? Must you wear false lashes? Guys, I'm still upgrading my makeup, I'm still upgrading my movies, I'm still upgrading everything. So join me in the journey of my upgrade. Thank you. Keep watching. Subscribe, share. Please guys, share these videos. People will have, they will learn a lot from it. Share these videos. Number 5 is breast problems. Usually after childbirth, we have some sort of breast problems. Some are expected, some are not expected. Some are things that we could manage at home. Some are things we cannot really manage at home. For instance, if you're having breast engorgement, the breast is so big, it's so firm and tender. There's so much pain associated with it, and it's warm. It's warm. Breast engorgement. Now, in this case, if you're having this, I've noticed a lot of women will say, oh, go and use hot water or warm water to press it, to do this, to do that. Please do not apply warm water because you're having that pain because you are lactating well and it's not going off your breast. That is the reason you're having that pain. So the milk is what is engorging your breast. Do not apply anything warm to hot on that breast because it will still increase lactation. That is number 1. Number 2, do not try to use breast pump to express it if your baby is not suckling. Because the more you use breast pump to express that milk, the breast pump tells the brain that, oh, somebody needs this, and the brain keeps producing more. So all you need to do is to relieve the pain, you need to use some cold, maybe some ice bags, place it on the breast that is engorged, and then you could get a tight, not really a tight, a fitting supportive bra. A fitting supportive bra. Let me not say tight because sometimes it's very uncomfortable to have a breast engorgement, not to come when you want to wear a very tight bra on it. But just get a fitting supportive bra that will help you hold the breast together so that there won't be more room for more milk accumulating. And then you apply the ice bags on them just to relieve the pain. And if the pain is so unbearable, please alert your doctor. He may give you some analgesic or some pain relievers. Now, another form of breast issue you may have after childbirth is mastitis. That is infection of the breast. Is quite common, and in this case it might be as a result of cracked nipples, and also these cracked nipples might be as a result of the baby not latching, very properly on the breast. Some people will just place the baby's mouth just on the nipples, and this may give you lots of tension on that nipple, and at the end of the day it will crack. But if the baby's mouth is properly latched on the breast, then you may not really have mastitis. I'm not saying this is the only cause of mastitis. There are several other things that may cause mastitis, but this is very common when you have cracked nipples and then you have mastitis. Urinary or fecal incontinence. Urinary or fecal incontinence, it means that you're not able to hold urine and you're not able to hold your feces. You're there and then the urine is just going off and then the feces is just going off. It's a very common occurrence. It's a very common problem after childbirth, and the reason is not far-fetched. By the time you are in labor, when you have a prolonged labor, of course the bladder muscles are stretched and sometimes they are injured. Yes, sometimes they are injured. That is when you have the fistula coming in. And also on the back side, the rectal muscles also are stretched and also injured. So this may cause some sort of fistula, but what we're talking about is incontinence. This incontinence may come up especially when you cough, when you laugh hard, when you cry, or when you lift something heavy. You notice that you're just dripping urine. And you may be so embarrassed and so surprised that why is this happening to me? Sometimes after some time it goes away on its own, but do not wait until it goes away. If you're having any form of incontinence, whether it's urinary incontinence or fecal incontinence, please alert your doctor, because it might be something more than just the urine coming on its own or the feces coming on its own. For instance, somebody who has a vesicovaginal fistula or rectovaginal fistula may not really know exactly how these things occur. So when you're having any form of incontinence, whether it's urinary incontinence or it's fecal incontinence, I urge you to alert your doctor. Hair loss. Yes, a lot of women experience massive hair loss after childbirth. Now, a lot of people feel, oh, if she's like what we used to believe then in my country, if somebody who's just delivered makes your hair, then you will have so much hair loss. I don't know if that really works. I don't know if that really happens, but I've never experienced such before. But the thing about hair loss after childbirth is that it's not really an abnormality. But some people may have so much hair loss that they will feel, oh, this is so embarrassing. Why has my hair just ripped off like that? Why is it shedding so much? Am I lacking some vitamins? Is there any problem I'm having? Am I having some hormonal issues? Is there any autoimmune problems and all that? The truth is that when you are pregnant, of course, you enjoy the luxury of having so much hair because of the hormones. Now, we usually have this normal hair loss from time to time, whether we are pregnant or not. We have normal hair loss. You won't tell me you don't lose your hair from time to time. Yes, we have normal hair loss. But during pregnancy, you notice that your hair is fuller and is thicker and is more silky and all that. It's because of the hormones. So during that period, you don't really lose any hair. During pregnancy, your hair is so full, it's so silky, so fine. You don't notice any hair loss. Now, after childbirth, when the hormones are relaxing, when the hormones are going back to normalcy, then you begin to experience those hair loss you would have experienced within that period of 9 months. That's exactly what happens. So it is somehow normal. You're shedding all the ones you were supposed to have shedded within the 9 months period. You were enjoying the fuller hair and the silkier hair. So that is what happens after childbirth. A lot of, I mean, it's so bad that people will be wondering what is happening to me. I just delivered and my whole hair is gone. So this is exactly what's happened. Do not be afraid about it. But if you think there are other symptoms apart from hair loss that you're having, maybe the particular hair loss is really giving you so much stress and discomfort, please alert your doctor. Postpartum depression, PPD, this is a very important part. If you have not been listening to me, if you have not been hearing what I have been saying, please hear this now. I have my reason for emphasizing on this particular one. Hear what I have to say about postpartum depression, because it's very common. About 15 to 20% of women will experience this postpartum depression after childbirth. Postpartum depression is common. It's common, especially after giving birth and you don't have a good support system. Most women in such a condition may experience postpartum depression. And it's not as if it's something you cannot come out of. You can come out of it. But family support, your friends being around, and you having that strong will that, oh, I need to come out of it, you will be able to come out. It's very common. You see some women after childbirth, they are regretting ever giving birth to that baby. You see some women after childbirth, they are not just interested. All the joy that comes with childbirth, all the joy that comes when you carry that baby is lost. They don't have it. You see some women after childbirth, they are looking at that baby and they're feeling so confused at what to do. This may be as a result of the new role you have to put up with as a new mother, as an older mother. You're just wondering, oh, this is so much. I don't really know much about this. How am I supposed to learn? How am I supposed to take care of this baby? How will I cope with this? Believe me, you can cope with it. Most people experience what you are going through. If you're really going through postpartum depression right now, most people experience it and they pulled through. So you can actually pull through. All you need to do is pick up. If you're feeling bad that you delivered the baby when you're supposed to be when you're supposed to be joyful, is a sign that you're getting depressed. If you feel the new role you're going to embark on, you're going to carry on, is so much above you, and you're feeling so confused, so disappointed in yourself, you don't pick interest in whatever that happens to that baby, please speak up, seek for attention. Tell friends, tell family, tell them what you're going through, tell them you need help. Because at this time, you need a very strong family support. You need a very strong support system. Because if postpartum depression is not well taken care of, it could gravitate to postpartum psychosis. That is when you see women harming their baby. That is when you see women having so much self-harm as a result of childbirth. That is when you see women hallucinating. Then you know that this is no longer postpartum depression, is now postpartum psychosis. A lot of mental issues go on, even in those who did not give birth. So you having that baby is a lot of stress, I know. It's a lot of challenges, but you need to pull through. You need to tell yourself, you need to encourage yourself, you need to motivate yourself, you need to inspire yourself for you to be able to pull through. And you need to speak up. Do not die in silence. Please speak up. It's a very common thing. Speak up. You're not the only one who is going through it. A lot of people have gone through it. I have been there, and that is why I'm emphasizing on it. Good support system will help you out. Speaking with your doctor will help you out. Speaking with any family member, any experienced person will help you out. So please do not hide under that shadow, under that shade of, oh, I'm depressed, I can't do anything for this baby. No, you can do a lot for yourself and for that baby. You should be joyful. You should be happy. I call them bundles of joy. And that is exactly what they are. So pull yourself together. Seek for medical attention. Seek for good support system. Tell a friend, tell a family member, and I believe you will be fine.